challenge. What happens sometimes, the parents, the parental acceptance is not there. The parent might feel guilty for one reason or the other. The parent might not be receptive, right? So it's very, at times it's very difficult and challenging also to convince the parent that yes, we are here to provide support to the child. It is for the betterment of the child. So initially we have to work on these things, and when the parent involvement is there, when the parent is ready to accept, then the effective intervention takes place. There, because at times during the parent-teacher meetings, the parents are willing to meet the special educator, the class facilitator, even the shadow teacher if it is required. So they are keen to know about the progress of the child, and even the class facilitator, the special educator, they can also convey to the parents, okay, this is how we are working, this is the learning plan, and if some additional therapies or additional sessions are required, so it is their own personal choice. They can choose it wisely. Maybe a child requires a speech therapy, maybe a child requires an occupational therapy, so that likewise we can discuss it with the parent, and effective communication is there. So it's not lacking from their end also, and we are sitting together and working on it. Key aspects of effective collaboration: role of class teacher, she is a primary facilitator, importance of special educators. Like I just said, sometimes one intervention works beautifully with one child, the other time it doesn't. Maybe for the other child you have to use some other intervention. Value of shadow teachers. See, if a shadow teacher is present in the class, she is spending most of the time with the child. She understands even better than the special educator, because she is the one who is going to observe the child very closely. So she plays the shadow teacher plays a very, very important role, and she is the one who can report to the class facilitator, also even to the special educator, about the progress or what needs to be done further. So collaborative communication strategies, like weekly or fortnightly, the parents can be called, and all of them, they can sit together, they can discuss about the progress of the child and how to go about further. This was again a video. I don't know if it's going to play or not. That's what all about today's session. Thank you so much. Any questions, please go ahead.
Ma'am, there is a child in my class who is very good in academics. She follows instructions very well. She does her work on time, but then she's very sensitive to sound. Anytime if I play an audio, video, anything, she will keep her hands on her ears. And second thing, ma'am, she doesn't speak at all. And but her speech is very clear. Like yesterday, if she has asked me, may I go to washroom? I like this sticker book. That's all for a day. She will not speak.
Otherwise, she will not
Yes. But then she's good in academics. So does she come in this autism spectrum or something like that?
See, we cannot, like I just said, we cannot label a child unless and until we go in for a formal assessment. But like you just shared, that the child is have the sensitivity
Sound.
to
Yes, ma'am.
sensitivity towards sound. So it could be one of the reasons, or that the child is not able to focus. Maybe, and the children having
Focus is good. Her speech is clear.
the children having autism are very good in academics, especially in mathematics. They will perform wonderfully in doing mathematical calculations. But the first thing is, if you have these observations during your classroom, you have been observing this, it needs to be shared with the
Ma'am, actually
community.
parents feel that she's very shy to speak up. So that is the only thing the parents have.
And how old the child is?
Ma'am, 7 years.
7 years. And the parents feel that she is shy.
Yes, ma'am. She keeps telling me that, ma'am, please motivate her to speak. And she speaks very clear. She reads very well.
See, these are the red flags. Like, if the child is not speaking for the whole day,
Yes, ma'am.
the child also has sensitivity issues.
Only
So
after
I think
motivation.
an informal assessment you've been doing, like you've been observing the child in the classroom. But the thing is, if it is addressed at an early stage, it can be managed. So that is why I emphasize that parental acceptance is very important. It's not like that we are very sure that child has this learning challenge, but it needs to be diagnosed. If there is a
What
challenge,
can I suggest to
you
parents?
can suggest the parent that these are the things that we've been observing in the class, we've been trying, and if it continues for a period of say 3 to 4 months and it is not getting better, then it's better to address this issue, address this challenge at the right time. Early intervention is always better. Then we keep on regretting that why didn't we address this issue earlier. And as soon as the parental acceptance is there, parents are ready to go in for a common assessment, then we know, okay, whether there is a learning challenge or there is not, and then we can proceed further. There are children who are shy, who are a little hesitant to talk, but it's not that they won't speak for the whole day or they won't speak with anyone. Have you seen it that the child interacts with other children for the period
Very
of
rare.
Very
Rare.
rare.
Very rare.
So these are warning signs. So we just need to clarify that is there any concern or not. So I think parents, they need to be convinced to go in for a common assessment.
Okay. Thank you so much.
Other questions?
Yes, ma'am. Thank you for the wonderful session. My question again goes to, now I can go with the word autistic child. As you said, they follow a routine. But my question to you is, as we are talking about inclusive education, there are many changes happening. It becomes very difficult for my child in my class to adapt to those changes, like even sitting with a different partner. So how these transition can be made easier for them?
See, if a child is having autism, this social interaction is missing. They're not ready to, mix up with the peer group. They would rather like to spend some time in isolation. If the push-out services can be provided, see, the classroom environment needs to be very conducive. That is why the resource room is a very important requirement of every school. That is why CBSE and other boards, they are emphasizing on the importance of having a resource room. You can assign duties, you can assign roles, you can assign buddies to a child with having this condition, but it won't be easy. It won't be easy initially. It requires a lot of patience on both ends. The class teacher also needs to be very patient. Even the child who has been assigned the role of a buddy also needs to be very sensitive and needs to understand that. And before that, it's very important to sensitize the entire class. This is where we all lack. That is why we need to have these counseling sessions with children, group counseling sessions, and where we need to address these challenges, that there are children with different learning conditions, and this is how we need to be very supportive and be empathetic and very, very compassionate with these children. And our support can contribute, and we can make a difference in someone else's life. But it won't be easy. So I would suggest that if the child can spend some time in a separate learning environment, it would definitely help the child. And there also you can make you can assign a buddy to that child. That child also can sit along and work with that child. So it works wonderfully. But it's, yes, because of the sensitivity issues, the child might not be able to focus in the regular class. So that is why we emphasize, okay, that the push-out surface might help the child.
Thank you, ma'am.
I just wanted to show a video also, like if a child is having a difficulty in reading, so you have to point out time and again, okay, put your pencil here, we were on the third line, put your finger here. And what they do, I don't know, because of some kind, the sitting posture is even not good. So they like to keep their one hand below their thigh, and you have to keep reminding them, अपना हाथ टेबल पे रखो, अपने शीट को लेफ्ट हैंड से होल्ड करेंगे, राइट हैंड से लिखेंगे. So you have to keep reminding them. So
There's a child in the class. I have to give him reminders to keep one finger distance between two boards because he is joining the schools. So and he is in the it's very frequently it's happening the flapping of hands and the change of facial expression as well. So can you do something about that? जब ये चीज होगी हो what should I do?
Now I'm sure that the parent might be, taking the child for some kind of therapy also. Yeah. So it's a slow process. It takes time.
So it is becoming more rigorous day by day. I don't know what's the reason. But that is
And sometimes, we are not aware there could be some kind of medication going on, or the child could be, there are certain triggers also. Sometimes the child is sleep deprived also. Sometimes there is something which is bothering the child, and the child is not able to process it. So all these things, when they come together, you can see the difference in the behavior. The child is not behaving in a right manner. So there could be numerous reasons, but yes, as long as the child is going in for occupational therapy, it's a slow process, but it does work. Yes, and you have to give those gentle reminders to the child that हम लिख रहे हैं, so let's focus on writing, no hand flapping. Even in some cases, you even also have to hold the child's hand gently.
Yeah, and I guess it actually works.
Yes.
It actually
Yes, there is a child in our school. It's very hyperactive. So the therapy center where the child goes, they have given the child those weights to the child. So they are tied in his leg or the right leg. So because they are heavy, so every time he'll be keen to get up. So you know that it requires a lot of effort to run. So this is something which requires specialization, and if the specialist is consulted for that, it would be great. Thank you.
As we small wonders, you get really young students, and it becomes difficult. As you're saying that we need to explain to the class, we try. Out of 20, maybe 3 or 4 would understand. Whereas they are at that stage that they don't know what they're doing. So to manage the class, we always, it's like if the child would go to the class, it's better. Especially
The push-ups are
the teacher is there, she will take the child out. As you're saying that there should be a learning center. As a teacher, would be wishing to handle this class if the child is out of the class. Like I have 2 students in my class, they're twins. This slow development is there. I don't find any other thing, but they don't speak and they're just drumming on the table or they're screaming. I don't think so.
And it's a distraction for the entire class.
Distraction for the class. I would rather want that
Yeah.
it's just at the top of their voice they'll just scream. So I'm not saying they're special learners as of now, I don't know, but I don't have that much time. The attention span is very less. I have to conduct a class. It's not that easy. Seems like a rosy picture.
Like I said, there are no quick fixes, and it's not an easy job. And
No, sorry to come to my question is that how to handle that those 20 children, to counsel them, then don't get distracted because they're already distracted. Very difficult for this age group.
yeah. So,
There were 3 children point in class
yeah. So like I said, positive and negative reinforcement, they work really well. So often, in our, when I am working with when I go and visit the classroom and I sit with them and I'm working with them and the rest of them are not working. So the next lesson maybe they have a fitness class. So it's a motivation for them that okay, next is the fitness class. So if we are not completing our work on time and we are getting distracted, nobody is going for the fitness class. So it's basically a trial and error method. So you have to keep trying. There are no quick fixes that this thing is certainly going to work if I tell them, and you have to remind them time and again. It's something that has to be done regularly on regular intervals, and you have to keep finding ways of keeping your children engaged. There are no fixed intervention for this, that this is you next day you go and share it with your student and it is going to work. So this is, and it requires a whole lot of courage also and whole lot of patience also to listen and pay attention to your children and just keep telling them, reminding them through different ways that okay, this is something very important that we are doing right now, and if we are not completing it on time, our work gets affected. That's it. I'm sorry for the video that I couldn't play them.
On behalf of the management, our school principal, I take this opportunity to extend our gratitude to Dr. Mansi for conducting an insightful and engaging session today on children with special needs and learning disabilities. Your expertise and practical strategies have greatly enriched our understanding and approach towards inclusive education. A heartfelt thanks to the Small Wonders team for joining us today for this meaningful workshop. Together, let's continue to build a more inclusive and compassionate learning environment for our young learners. At Smart Wonders, we are committed to supporting every learner. Our CWSN policy focuses on early identification, individual educational plans, collaboration between class teachers, special educators, shadow teachers, and regular progress to review and ensure meaningful inclusion. I would now like to share with you our referral forms, sample individualized plans, and tailored worksheets for children with special needs to provide an insight into our inclusive education policy here. Neha ma'am. So this is the referral form by the special educator, where the children where the teachers fill in their remarks. The special educator also, and then this is shared with the parents, so that they can go ahead for the diagnosis. Ma'am, just let it stay on for a minute. So the comments are by the special educator. The sensory concerns, social interaction, daily living skills, academic concerns, and the behavioral observations in the class. Ma'am, could you please move it? And then we have the comments by the class educator for every subject, whatever the class educator observes. So this is then shared with the parents, and the parents are asked to submit a diagnostic report. We could come to the IEP. Once the child has been identified with learning disability, we create the individualized educational plan for the child. We're going to be sharing the tailored worksheets class-wise. So there's on one side is the tailored worksheet. We do not modify the syllabus. This is something very important. But the worksheets are more pictorial and engaging for the children with needs. So this is a CWSN worksheet for a child with learning disabilities, and the other one is for the mainstream students.
The left one is CWSN? Yes. So it is more picture based, as you can see. Picture based, and that's the direct one. Both the worksheets you
Parallelly only
Yeah,
use the-
Pankaj just displayed parallelly. So in this CWSN worksheets, we have a lot of MCQs match the following. The pictures are bigger and it's more pictorial, and the children are encouraged to color.
Less of text and more pictures.
The folders are laid on the table here. The teachers can have a look. You can go through the worksheets. Thank you so much for the patience and for being here. Have a good day. Thank you, Mansi ma'am. Thank you, Ruchika ma'am.
So thank you so much. We will keep meeting, and the shadow teachers are also there. I hope shadow teachers who all can they can just raise their hands. Okay, Ajay, you are from Small Matters. So I hope आपको अच्छा लगा सेशन अटेंड करके. आप और अच्छा ऑब्जर्वेशन लीजिए, राइट? So आप constantly बच्चे के साथ हैं सुबह से लेकर शाम तक. Please start seeing what changes the child is having, right? So, and the class teachers have a major role to play. There, I do understand the question was asked like how do we, there's a distraction in the class. This may happen. You have to accept it. That acceptance of those 40 children is also very important. So what slowly when we talk about it, making a peer group for that particular child, doing some activity with that particular child, a group of children. So there are small intervention you can do it in your class where the acceptance will come from other children. Otherwise, the child cannot be, growing in isolation. Please understand, inclusive does not mean take the child outside and the child is with a special educator doing the worksheet. No, child has to be in the class. That's what inclusive education is. For certain deficiencies or certain things, you can take the child out and special educator can always help, right? But the growth has to be in the classroom, right? The overall growth of the child, normal child as well as CWSN child, both have to be there in the classroom. Pull-out session, we also call it pull-out sessions. Like for some few things, deficiencies are there, we take pull-out sessions. There is a terminology called pull-out. I hope I'm correct in that, I'm not an expert, but yes. In good schools, there are pull-out sessions. We also have resource room. We need to create a resource room. Unfortunately, we also don't have it in Smart Matter School. I don't know about Small Matter. We need to create a resource. There are a lot of other things, manipulatives. We also have some different kind of equipments are there. Like how we do gymming. We go for physical gymming. There is a brain gymming exercises also. Where will you do that? In the resource. So whenever you get an opportunity, the heads and all, if you can make one small little resource room, depends on the strength and the the availability of the infrastructure. If you have it, please create one resource where the pull-out sessions will happen. Special educator has its own role to play, class teacher has its own role to play, coordinator has its own, and the parent. All have to be synced. If there is any mismatch, the growth will fail. So with that word, I will thank you to everybody, all the team at the back. It's already have a lovely weekend, and please join us for a cup of tea, all of you. We had made some arrangements, so please honor us with that. So thank you so much. Thank you, Gurpreet. You were wonderful. Please give her a big round.